All right, Maria, it is officially 2 after the hour. Shall we go ahead and get into it?
Let's get us started.
Right. Okay, so welcome everyone to the Medicare by Those workshop. We're really glad that you're all here and that there's so much that there's interest in working not only with communities of color, but also reaching out to communities that prefer communication in their first language. So again, welcome and thank you for being here. My name is Mari Lopez. My pronouns are she and her, and I'm an organizer with NNU, and I live in California. And presenting with me today is Maria.
Hi, all. My name is Maria Torrez-Lopez. I live in Florida, pronouns she, her, hers, and I'm very excited to have you all here.
Awesome. Thank you, Maria. So we'd like to know who's represented here. We don't have a lot of folks attending, but if you want to say hello, Sanji, if you want to say hi, because I think it's right now it's you and Kelly Kuginger as well. And so if you'd like to say hello and tell us where you're calling from.
Yeah, hi, I'm Sanjeev Sriram. I'm a pediatrician in Maryland, and I work in Glen Burnie, Maryland, Anne Arundel County. It's rapidly growing as a Latinx immigrant community. So I mean, my broken Spanish gets me through my clinical workday, and I definitely want to step my skills up to make my to make to be a better activist for my patients. And so that's a big part of why I'm here, is because I'm kind of doing broken Spanish in clinic, and I want to kind of up my game outside of clinic.
Thank you, Sanjeev. Kelly, this is I don't know if you want to say hello really quickly.
Yeah, hi everybody. Sanjeev, it's good to see you again. And Maria and Madi, I see you every day, and I'm so thrilled that you're doing this. So I'll be off camera for just a bit, dealing with some other things, but I'm fully engaged too.
No worries. Thank you, Kelly. So Sanjeev, I just wanted to let you know also that this presentation is going to be in English, but I want to let you know we do have some webinars on Medicare for All in Spanish. So if you're always more than welcome to come and join those. They also kind of give you a sense of how words are pronounced in Spanish, get familiar with some of the concepts and how they're presented in Spanish. And I love them because it's a great way to brush up for me as well. And so, yeah, and then if you want, come and speak Spanish to us as well, and we'll respond to you in Spanish, of course. All right, fantastic. So I'm going to go ahead and start screen sharing again. One moment, folks. All right, and let's just jump into this. All right, so thank you so very much, Sanji, for being here. And unfortunately, it's you for now, so you've got our full attention. But we're really glad that you're here for the Fight for Guaranteed Healthcare for Everyone. Especially now that the demographics are changing in your state. I mean, it's so wonderful that you're here to try to that you're here because you want to be able to connect with the community and just be a best provider as possible, being sensitive to their needs. So really quickly, just want to share with you, you probably heard this, but NNU is a union of registered bedside nurses, and as the country's largest union of registered nurses, NNU, along with other organizations, has been building a national movement for years in order to comprehensively transform our healthcare system. And we believe that it's really critically important that our campaign engage and include Black, Indigenous, and other people of color. This Medicare for All would drastically improve the health of communities of color and reduce racial health disparities. And so these communities must be central to and leading this fight. So with this educational campaign, our goal is to continue that process of building a stronger multiracial base to pass Medicare for All. All right, so as we all know, Black, Indigenous, and people of color, also referred to as BIPOC, don't receive the care that they need and are oftentimes denied adequate healthcare treatment and services. BIPOC folks are less likely to receive job-based health insurance and more likely to live in medically underserved areas. Life expectancies are far lower and health outcomes are far worse, depending on one's zip code, ethnicity, and income level. And for these reasons, NNU is committed to working towards dismantling the inequities in our healthcare system. So what we're going to be presenting today is one of the programs started within Medicare for All to ensure that people of color are becoming central to our fight for Medicare for All. So in today's workshop, we'll be starting with NNU strategy for reaching out to communities of color, for particularly the Latinx community, including methods, strategies, and the tools that we employ. It's our hope that what we share during this workshop is applicable to your work, and that we contribute to your methods, that we contribute something to your approach and your methods with the resources that are available to you. So specifically share our agenda with you. Specifically, we want to share some statistics, starting out with some statistics about the Latinx community that makes the case for Medicare about those program. Then we'll share some current activities of the MPT program, including our texting and phone banking work. We'll follow with an overview of our organizing conversation and relational organizing that will be part of our MPT breakout for the National Medicare for All Festival that's coming up in April. And we'll share that link with you all in a bit. Then we want to turn the tables and ask you about your biggest challenges in organizing in communities of color. We'll be doing that in breakout rooms for about 50 minutes, but given the fact that there's just one person, we might just use that time to have a conversation, depending on how many folks show up or don't. And then we'll end it by, of course, with the Q&A, and then wrap up the workshop with some links that we want to share with you as well. All right, so let's get into the program. All right, so the Medicare by Those program, which we also refer to, again, as I've been using already, MPT is a component of the NNU's Medicare for All Black, Indigenous, and People of Color Outreach Strategy, also known as BIPOC. National Nurses United has a history of calling for an end to racism, not just in the healthcare setting, but also in our society. Nurses experience inequities daily that are embedded in our healthcare system and that were founded on the intention to provide minimal and inferior care to BIPOC and maintain that division among races, even in medical schools. For these reasons, nurses understand that people of color must be a central part of the campaign and movement for Medicare for All. And we put together a document on the impact our healthcare system has had on communities of color that Maria will post in the chat. Changes that are not only life-altering on an individual basis, but at a societal level have occurred when the majority of the public make their voices heard. And that's what's it's going to take for a wholesale transformation of our own healthcare system. But it's going to take those most impacted by these discriminatory practices to be and have a central role in the Medicare for All campaign. Let's see, trying to get a transition slide here. Okay, so and it's for these reasons that MPT was created. Spanish is the second most spoken language after English in the U.S., according to the U.S. Health and Human Services Department of Minority Health. And in 2019, the Latinx population represented 18% of the U.S. population, with 71% speaking a language other than English in the home, of which 28% reported a lack of English fluency. Also in 2020, the 2020 report by the Pew Research Center, the population not only continued to grow, but it's also migrating across the country, with the South, Midwest, and Northeast being the most popular destinations, all of which have reported increases in their Latinx populations. The COVID-19 pandemic, which has created a devastating economic crisis, has only exacerbated our ongoing healthcare crisis for BIPOC communities overall. And we've seen this shocking rise in racist, misogynist, anti-immigrant violence and hate incidences targeting Asians and Asian Americans during the pandemic. And at the same time, we've witnessed the largest social movement in U.S. history, led by Black Lives Matter activists and movement for Black Lives leaders. So now more than ever, it's really time for us to build a multiracial, broad-based movement that centers communities that have been historically been and continue to be underserved and excluded. And the sheer size and influence of the Latinx population, as well as the breadth of change that will occur with guaranteed healthcare for all Latinx, makes the Latinx population, as well as communities of color in general, a vital necessity to winning Medicare for All. And this is how we're going to achieve true healthcare justice. So with that, I'm going to pass it over to Maria, who's going to present our next segment.
Thank you, Maddie, for that overview. Yes, so let's get started with the program overview. So begin an overview of the MPT program so you have an understanding of our current work. We began MPT because of the size of the Latinx population in the US, and honestly, because there was a depth of experience on our team of working with communities of color, organizing in BIPOC communities, and Spanish-speaking fluency. So we coupled those resources and skills with the need to create Medicare para Todos. Since that moment, we haven't stopped working on expanding the program and using it as an example of what community organizing and language justice looks like in our movement for healthcare justice. MPT seeks to recruit the Spanish-speaking community into the campaign and movement for guaranteed healthcare for everyone. Our main inspiration for MPT was to get the word out as quickly and as widely as possible to the overall Latinx community. Latinx community, aside from having the second most spoken language in the US, they are also the community is oftentimes characterized by a tightly knit family structure, which you probably see in your practice, in which multiple generations live under a single household. These could mean multiple members and generations of uninsured family members under one roof. It also means that our possibilities for organizing are exponentially maximized. Our first step in promoting MPT was to begin translating our existing materials in Spanish. These provided an introduction to the campaign and what we were trying to achieve for the Spanish-speaking community. Remember, for many communities of color, the concept of medical insurance is still new and a little bit confusing, as many people of color remain uninsured or receive Medicaid. So we need to help folks contextualize the idea of creating a system where healthcare is open and provides everything you need, including dental, vision, and hearing, without a focus on the cost. Our materials in Spanish were made available on our website and distributed to organizations. We're gonna go ahead and post a link on the chat to access our MFA translated materials. When we then followed with the creation of the Medicare para Todos Facebook page. Facebook, followed by Instagram, are the most popular social media platforms used by the Latinx community. All of our posts, invites, and communication is in Spanish on that Facebook page. We sent out friend invites to some contacts and organizations, and some folks found those in their searches. And so we began to build our online community. We'll also go ahead and post that link in case you would like to use it and also share it. As many people began hearing of Medicare para Todos, they still had a very little detail of what it was and who we were. So we began offering Medicare para Todos one-on-one webinars in Spanish, allowing us to introduce the movement. Now, if you're interested in attending, we'll post the next webinars in the chat. They're coming up this week and following week. As MFA in general, as Medicare for All in general began to expand, and more people of color began joining the movement, the number of those who were bilingual Spanish began joining our Medicare para Todos team. They did so by joining the MPT texting program. So if you're interested in joining as well, that link will be posted in the chat, or if you just want to see the information that we are passing along. Along with Medicare para Todos webinars, we have been providing our MFA and communities of color webinars that make the case as to why we won't win guaranteed healthcare for everyone without people of color being a central part of our campaign and movement. These webinars share the racist history of our healthcare system, how hospitals changed their Jim Crow policies after the passage of Medicare with the help of civil rights activists, how much more change still needs to happen to authentically address racial disparities in our healthcare system, and how the passage of Medicare for All will be a big step forward in addressing these disparities. These webinars are an important part of our work as we are able to thoroughly lay out how broken our healthcare system is, discuss the profit motivation behind the healthcare industrial complex, as well as provide the statistics and data that prove what we know to be true about the failed US healthcare system. These presentations walk the audience through the history of racial disparities in our healthcare system and how devoted activists have fought hard to address those disparities to present day and the COVID pandemic that has revealed the continued depth and comprehensiveness of these disparities. Last year, Medicare para Todos, we escalated our campaign to include texting to California Spanish-speaking populations to share MPT. Today, drawing from just a small sampling of contacts in the state that we reached via texting, we identified almost 10,000 new monolingual Spanish-speaking supporters for Medicare for All. In addition, our MPT texting program was so popular that we were able to build a team of Spanish-speaking texters, and it continues to grow. These texters handle the majority of our outreach in Spanish and have developed their own skills to where they're able to help with managing the MPT campaigns as well. Now we're very, very excited to announce that this spring, we'll be hosting our first Spanish language phone bank for our National Day of Action in April 23rd, the Medicare for All Fest. We'll be providing live Spanish translation and have a breakout room workshop for Spanish speakers where we will share the MPT program and share our Senate MFA petition drive, which will also be translated into Spanish, and discuss how to share the campaign with other Latinos. If you're fluent Spanish speakers, we invite you to use one of our phone banking supporters to invite them to the National Medicare for All Fest in April. We have opportunities to join the MPT phone bank, and so we'll post those links to register in the chat. If you happen to not be a Spanish speaker, but you have friends and family members who are, please share the links with them. They can easily join in and learn more. So now we're gonna go ahead and share a little bit of our methods. And so let me turn it up to Mari so she can go over those.
Great. Thank you, Maria. So we're going to spend a few minutes to focus on our outreach methods. And again, these are our methods, and hopefully there'll be some takeaways for you as well, Sanjeev. So when it comes to communicating the campaign with the Spanish-speaking community, it's necessary to ensure that our language, our phrasing, and terminology is familiar to Spanish speakers. And this is probably the most important parts of our outreach. If our audience is unfamiliar or cannot relate to the concepts that we reference, then we won't be successful in inspiring them to join the movement for MPT. And this is necessary for documents, presentations, and other forms of communication, so the community is clear on what the campaign is trying to achieve and the role that we're asking them to play. This is really just the first step. The real work comes in establishing relationships with the communities in which you wish to work. As advocates, we see enormous connections among issues impacting communities of color. Low-wage jobs lead to poor housing. Poor housing can contribute to poor health, for example. And to reflect our understanding of the multiple hurdles that the Latinx community face during our presentations, we provide the number of people affected, the research that demonstrates a correlation of certain social and economic issues to poor health and lack of health care, as well as the long history and persistence of these challenges in the documents that we share. So not only are we able to demonstrate that we see their struggles, but that they're not alone, and that we believe MPT is a critical step toward addressing these intersecting issues. And of course, listening to our community is vital to understanding how these challenges personally affect them. Much like how we listen and share compelling healthcare stories for MFA. So this is going to lead me to transition into another layer of our upcoming work, which is organizing conversation steps and relational organizing that we're going to actually be taking our volunteers through to help them begin speaking to others about Medicare para Todos. And this step is the most significant in our opinion, as we know many Latinos are struggling with healthcare. We mentioned in that 2018 Pew Research Center report above, earlier, in which we also stated that 27% of Latino households are multi-generational. And so it's quite likely that these entire households are uninsured. So training our MPT volunteers to have conversations with their own families and friends about our broken healthcare system is really, really vital. So I'm going to go through how we guide our volunteers into speaking with others about the campaign and movement. And there's this method of having conversations that bring people into the movement for MFA and Medicare para Todos, in our opinion. So we're guided by what our 6 organizing conversation steps, and I'm going to go over them one by one and elaborate on their importance and their connection with communities of color. All right, so as you can see, these are the 6 steps. And the first that we consider really, well, it's vital, important to any conversation you begin, right, is connecting with the issues when you're starting that conversation, right, and the interests related to healthcare, because we're talking in the context of Medicare para todos, right? So most communities of color are struggling, mostly are uninsured. And again, as Maria mentioned about the multi-generational households, folks are worried about getting care for kids, parents, and grandparents. And this is an issue, as Sanji, you probably know, that most important for women who are generally, and across, I think, communities of color, women are generally the caregivers in the household. So they're the ones probably absorbing all the stresses and making sure that, you know, multiple generations within the household get the care they need. So connecting with that is probably the most vital step in beginning the conversation with folks about Medicare for all, Medicare para todos. Second is agitation, what we call agitation, asking them what they think about our healthcare system. You know, are they and their family struggling to get the care that they need? Are they concerned about family members getting COVID-19? As we know, many BIPOC folks are working essential jobs right now, and so are having to leave the home and be out in the world where unfortunately this disease is still rampant in many areas. And so, you know, is this a concern? And so we want to connect about asking them about this, that something's going to get them to start thinking and about how and kind of bubble up their frustration, if you will, about their inability to get the care for, again, parents, grandparents, children, and even for themselves. Third is the hope and the solution and sharing our plan to win. We'll let them know that there's a solution, which is Medicare para todos. This also sends a signal that people care about everyone, no matter their race or ethnicity or language, and that we're all fighting this together. You know, we know that Medicare para todos is not going to solve the problem, but for the way we understand it, and we know it, this is the first step, not just for Latinx community, but for everyone to get guaranteed health care. And so, you know, letting folks know that there's, again, this solution out there, that there's this movement to change our system to get them and their families the care they need is an important part and key ingredient into these conversations. Next is the urgency. We want to let folks know that that the reason why we're asking people to get involved is because it's important now. Folks are suffering now. People are dying, you know, because for the lack of health care and health coverage. And so, you know, also with someone in their family should become ill and they need care. And again, they're faced with not having insurance, not being able to cover the costs, not getting fully the care that they need. And so again, going back to the fact that, you know, many of these households have are multi-generational. They have aging parents, and they should be able to get the medical care that they need without the worry about costs, right? Or if their child gets sick, you know, and their again their insurance doesn't cover if they are insured, that, you know, they worry about the copays and other costs associated with health insurance. So again, you know, there's a need to change this, and we all understand the reasons why, or list some of those reasons why. Again, because the need is now, particularly in the context of the pandemic. So next is the confident and our hard ask, as we call it, and gain that commitment. You know, you want to also be kind and be confident and unapologetic about asking folks to get involved. And this is really important, as we spoke earlier, because many times, you know, people of color feel when there's a movement happening on nationally, a lot of folks maybe don't understand or don't see themselves represented in these movements. And so being asked to be a part of it is really, you know, it's something that's welcoming, even if, you know, there's the commitment that they can make may be minimal at this moment, or, you know, they're going to do what they can. Just getting them to making the ask provides that feeling or gives that feeling that you think that we think that they are worthy, not worthy enough, or important, and that their existence and their time and efforts, will make a difference in this campaign. And so just being asked to be involved is really, really important for communities, especially particularly for our campaign in Latino communities who struggle who struggle with being excluded, being profiled and so forth. So being asked to be part of the solution is a great way to get folks to involved in the campaign, of course. And but again, it sends a message that they are valued and are a part and and a sought after component of this movement. And then you want to follow up. Maybe again, as I mentioned, they're unable to at this time, but you want to keep engaging in that conversation and bringing it up, so that again, it's like I haven't forgotten about you, and you're still valuable to us. So we hope that you can join us when you're able to. So these are the steps that can help guide anyone to begin speaking to others about MPT, and of course Medicare for All. When we present this guide, we couple it with our relational organizing that I'm going to go through in a second, to let people know that they are not alone, and that we share the method of relational organizing with supporters and volunteers. And it's a system that we are going to be using in our National Medicare for All Festival on April 23rd that Maria had mentioned. And of course, that link we're going to share in just a moment towards the end of the presentation. All right, so relational organizing. This is the practice of reaching out to those in our network to tell them about the campaign for Medicare for All and to inspire them to sign up. We support their efforts by also teaching the method of the response cycle. And so again, this is something that we are going to be sharing with in our Medicare for All, Medicare para Todos festival in April. And this is something important because this is a very new concept to a lot of folks. And so giving them the tools is going to be able to share and talk about this is going to be really, really important. And this responses cycle is designed to be used in conversations when the person you're speaking with needs further convincing or inspiration when making an ask for support or to take part in an action. And this process can be used to overcome objections related or to supporting Medicare buyers as well, and even maybe getting involved with the campaign. So I'm just going to take a few minutes to go over this. And so, of course, it's listed there that you can see. The first one is listen. I think, Sanjeev, you know how important this is in your own practice. Active listening is really really key and fundamental to organizing. Listening to folks' key concerns. Really, again, we talked about the intersectional issues that many Latinx communities go through. And so sharing and talking about that experience, or listening about that and making those connections later on in your conversation is going to be really, really key. So listening is for us, again, the most important part of this response cycle method. Secondly, acknowledging, right? Acknowledging and validating what you've heard. So if you're listening to someone talk about, their healthcare struggles for themselves, their families, the frightening thing about going to work and being exposed out there, you want to really acknowledge their concerns and their stressors, letting them know that you hear them and, and that they're not alone in their experience. Some of the statistics that we share with you, those are things that later on you can acknowledge as well, and indicate to them that you've heard them, and how not having care for themselves, parents that they're caring for, or anyone in their family, how stressful it can be. And then next is sharing. You want to share your own personal story with them, or maybe stories of others that you can relate to what they're sharing. The most important thing is building rapport with you, right? Because again, this is communities of color really struggle with, with trust. I can say that for speak on behalf of the Latinx communities, that we struggle with trust. We don't know, if folks are really trying to honestly there to help, and so building that relationship is really important. And you can do that by sharing, because it also reflects the fact that you're listening to them. And so you can, say things that, I've been there, or I know someone who understands, who went through exactly what you're saying. You know, you can connect it to the costs, and you can, you know, we've also been hearing through the news about, and what Rose Roach mentioned earlier about the U.S. population distrusting more and more the corporations. And so, you know, connecting with those issues, because, you know, again, this is a universal, I think, experience for people of color and others. And so, you know, and just sharing things about, you know, folks that maybe are uninsured in your own networks. And again, just relating with them and connecting. And then you want to make your case, right? You want to transition from telling your story to telling them why you support Medicare para Todos, and taking action. Um, Again, maybe using this moment to incorporate the concerns that you may have, that may have risen, you know, as you are having your conversation. You know, again, going back to that point about corporations rigging the system in their favor, and that it's not going to stop. And that what it's going to take is everyone being involved, and, you know, regardless of ethnicity, medical condition, or language. You know, if we're going to win Medicare for all, if we're going to eliminate insurance, and the need to purchase insurance and get guaranteed health care, then we need everyone involved. And so, again, making that case is going to be really important. And then the ask, you want to ask them. So, you know, you've heard about what we're talking about and how important it is, how, you know, what I'm talking about, how important it is. And so asking them to join Medicare para Todos is going to be really, really, it's going to be, you know, it's the crux of your conversation. You know, you could start by asking them to join an event, you know, connect them with the campaign in some way by sharing the website that we're going to be sharing with you in our links towards the end of this presentation. And then again, giving them the tools to get them to enable them to learn more about the campaign and the change and movement for Medicare for all. And then lastly, if you need to repeat some of the points, because again, you know, there's going to be doubts, as you know, we all know, people are going to say, I don't know, you know, I don't have the time, or those corporations are just too big. You know, listening to their objections, you know, about their concerns. Again, our first point is about listening, you know, and sharing maybe a little bit about yours or your own, and how you got started and what they overcame, and how you overcame some of the things that you hear about why we can't do it, or no, this is too big, or just some of the things that, again, that maybe you've heard, or that you've heard from other people about their hesitancy to be part of the campaign. Because we all know that everyone wants change. Our healthcare system is unacceptable, but you know, to think about changing the system in folks' minds could be a little daunting. And so, again, you know, sharing some of these, repeating and sharing some of these concerns, or sharing some of your own experiences about overcoming some of these hurdles is going to help you also make your case. All right, so hopefully that was helpful to you. And so with that, I'm going to go ahead and turn it over to Maria, who's going to lead us into a little bit of discussion. We're just going to open it up. You know, this was going to be our breakout, but, you know, given our small size here, we're maybe just going to use this time to have a little discussion or to answer any questions. Maria?
Thank you, Mari, and thank you for all that information. Very important when we're trying to, you know, create and build the movement. So like Mari mentioned, we're gonna change gears a little bit. You have heard about the outreach strategy for Spanish-speaking Latinx communities through the Medicare para Todos program, and how we're escalating and engaging to include organizing conversations and relational organizing. And now we want to hear from you. Specifically, we want to hear from you about your experiences organizing with the communities of color. We have 2 guided questions that should be in the slide, in the upcoming slide. I'm gonna read them, but they're also there. So what is the greatest challenges in working with BIPOC communities? And number 2, what tools will you identify as necessary to helping successfully engage BIPOC communities in Medicare for all? As communities of color, we share common threads of living in a country that sometimes sees us, treats us, and judges us differently. So we look forward to hearing on your unique experience in advocating and organizing in BIPOC communities, on how you help guide them to be part of this movement of Medicare for all. Like Mari mentioned, these were supposed to be breakout sessions, but we're gonna go ahead and do it right here. So Sanji or Kelly, if you're still around, if you would like to share with us, please go ahead.
Yeah, this was great, and I was telling Mari at the beginning of the hour that I've got a hard stop at 5, and so I've got my kids I need to get to. But I really thank you all. Kelly and I actually worked together at Netroots back in, I think it was 2018, was it? Like we were in New
it was
Orleans.
20. Can you imagine those 4 years ago?
Yeah, it was like it was about like 2,000 years ago, like
Yes.
when you
in
could
lived
roam the
years,
earth
it was
and like
2,000 years
actually
ago.
see people's faces normally. Yeah, it was great. But yeah, since then I started the All Means All campaign at Social Security Works, and it's about making racial equity a cornerstone of Medicare for all. And so to answer really that first question, I think one of the things that I've really worked on is to kind of dismantle a lot of the white talking points about Medicare for all and just like bring it to community where they are, right? Because like one of the things that I love to kind of point out to people is that if I was working in Southeast DC for 10 years, now I'm in Anne Arundel County, and it reminds me so much of LA where I did my training, where it's like just so dominated by immigrant families that if you're going to talk about Medicare for all and just compare like what Norway and Scandinavia and France are doing compared in the UK compared to the United States, it's like that is a lot of white peopling. It isn't like about like Medicare for all like here. Like, okay, what does that do here? Because healthcare is experienced so locally that yes, I mean Bernie can talk about Medicare for all nationally. That's because he's got a national audience and he's responsible for the nation. But like, to be able to talk about it as like, okay, like, we all know that this local hospital over here just closed, their L&D ward, right? As if like pregnant women just don't exist in this community anymore. It's like, like we all know that that's nonsense. Like we need an L&D ward wherever there are women. Like, we need pediatrics wards wherever there are children. And yet hospitals shut these things down because they're not revenue makers. And I like to kind of get into that because people are like, yeah, I had to go and take my kid all the way over here. Or like, when people are like, yeah, my sister-in-law had to go all the way across town to deliver her baby, like those stories start to come out. And it's like, okay, now we're talking about local pain. Now we're talking about local struggle. And why is that happening? And I think like the more that we get into that, I've always really felt like now we are making Medicare for all a real thing where real people live their real life. It isn't like this out there, like Bernie talks about it and it sounds great, but I don't know what that means, in my day to day. And I think like that has been like a huge part of what I've tried to do with All Means All. And to me, I feel like the where I do hit a lot of the barriers is in language, and that feeling that like when you hear a lot of Medicare for all people talk, they say like, oh, it's going to be healthcare for every American. It's like, yeah, not everybody in America is an American. Like there's a lot of folks that are like, either on their way there or are not really there, or just maybe not even interested in becoming that name. And and I've like encouraged a lot of my comrades, like we got to start saying every person in America will have healthcare, that every human being in America will have healthcare, because that way, like it's such a subtle difference, but it's one of those differences where people feel it and they live that difference. And so knowing that you can like, make a newer connection and a stronger one just by that turn of phrase, I think is huge. But I mean, like we keep seeing that that brought up, right? Like every American will have healthcare. It's like, yeah, that'd be great, but that's not enough, right? And one of the things that I've also tried to do to kind of like bring things back to the political arena is I created congressional district fact sheets. I'm going to put the link here. So this is like
we use them. Thank you so much. We totally use them.
So every congressional district pre-pandemic, this is all pre-pandemic data, And it pretty much shows that in every state in the country, it is a racial injustice to be uninsured. And then it's like huge, like, I mean, disparities. When you get to like the Southwest, it's like, this is like a leading, like, I mean, it is a huge leading issue for communities of color across the Southwest, across the South. But then when you get to the Midwest, you get into these interesting kind of dynamics of like, just being a person of color sets you, like, I mean, so disadvantaged for engaging in healthcare, that I kind of feel like, it's been helpful to remind a lot of our would-be allies that when they talk about, we want to get back to normal, I'm like, this is the normal that sucked for a lot of us, and it's not okay to come back to this normal. So when you talk about normal, how about we build a whole new normal? And so I'm working on new fact sheets. It's taking a while to get data from post-pandemic, but I just wanted to, thank you all. I hope we can collaborate soon and work together. I'm gonna keep working on my Spanish because I definitely want to participate in the things that you guys are talking about. But it's rusty.
Not at all. I'm sure it's pretty good. This is just really quickly. Sanjeev, the information that you shared, you should. I wanted to recommend a study. You're probably familiar with it. Dr. Tony Eaton, or I think he pronounces Eaton, but it's spelled. I'll put it in the chat. He actually did a study, extensive research on zip code healthcare and connected to your zip code. So wherever you live will determine the longevity of your life. Really interesting stuff. Because of it's exactly what you talked about, and we can identify easily that communities of color have the longest lifespan according to, and they are living in the zip codes again that are kind of bundled that expectancy occurs. Kelly, I'm sorry, I think I interrupted you.
No, by all means, I'm sorry. Sanjeev, we do a BIPOC Medicare for All webinar quarterly. Mm-hmm. Where we like to invite somebody who's actually out there organizing in communities of color to come and speak as a guest speaker. And I'm wondering, like, if you would be okay if we reached out to you about that, so that you can talk about All Means All. But I think it's probably a good idea, Madi and Maria, for us to think even sort of more specifically about how to, because I mean, Sanjeev has done so much stuff, like how we can partner with what he's already doing.
Yeah, that would be incredible. I mean, again, Sanjay, I think you obviously know the struggles it is to get communities of color in the movement, and so this is what we're focusing on. And so you've heard about Medicare para Todos, but we're actually now beginning to work and focus in on API communities as well. And so, but it's again, but we're trying to make what we want to do is make connections with folks who are already working in those communities, again, to just share knowledge, figure out how we can be of support, and spread that out, and then make them central, make people of color central to this movement. I'd love to work with you.
Absolutely. Yeah, this would be great. That would be really great. I mean, I just feel like, what we're touching on is like, it's really just hyper localizing these conversations so that it's felt locally and like, personally first, and then it's felt like in like those larger, more abstract things, because I think that was like what was really hitting me this past Tuesday at that hearing when the oversight of government hearing, I was like, we're at our best when we're personal, like and we're really struggling when we're only talking at like this like high altitude place, and I think that like knowing how to be able to, bring the communities in, but then at the same time, like help a lot of like poor white folks understand that like, this difficulty that you've had with the wrong people getting healthcare is only hurt you. That like when you make immigration status such a big obstacle for healthcare, like your local hospital is hurting, like because this person is not counted. They're not like part of the equation. And lo and behold, service, like when you show up at the hospital, services aren't there for anybody. And so it's like, to kind of try to like bridge some of that. I think we've got like so much work to do, and I feel like this feels like a lot like fresher approaches than what we've been doing before, and so I'm really excited.
Thank you so much for that,
Yeah.
Sanjay. Yeah, no, we're very excited too. We have continued to grow, and it's been really good. I know you have to leave rather soon, but I just wanted to say thank you for being here, and and yes, we would love to have you on one of our or multiple, because the information that you have is amazing.
Yeah. Yeah, happy to share.
Spanish, Sanjeev, even with your Spanish struggling, we'll bring you on to a Medicare para Todos presentation.
Hey, there's nothing to it but to do it, you know, like, I mean, like that, like, and that it's, I only like got like the little bit of broken Spanish that I got because I got over myself and just like, you know, tried. So I'm gonna, you know, just do the same thing again and, you know, just keep pushing. Yeah. But thank you all. I really appreciate it. This has been awesome.
Thank you so
and Kelly,